Hi, my name is Dr. Arthur, and I'm a current surgical resident at East Carolina University Vidant Medical Center. Today, I'm going to talk to you about our research looking at shelter-in-place and the impact this had on pediatric trauma, especially this increase we saw in penetrating trauma in children. So as a background, we know that pediatric trauma changes throughout the years, with increases seen during holidays and summers when school is closed. Knowing this, we aim to assess if there are any increases or changes seen in the type of pediatric trauma during the COVID-19 pandemic. In our state, school closure started March 14th of 2020 due to governor's orders. So our data comes primarily from the North Carolina Trauma Database. We also queried the North Carolina Death Certificate Database and the North Carolina Child Welfare Database. Our data was analyzed using standard statistical methods using SPSS software. For our population, we looked at the trauma database starting March 13th, around the time of school closures, through August 17th, which was the most up-to-date data that the database had at that time. We also queried the database for the previous 2 years in order to complete comparisons. We had a total of 5,597 pediatric trauma patients identified. Overall, we saw changes in quite a few areas. There were decreases in the total number of pediatric trauma cases. There were also decreases in child abuse trauma and reports, and injuries due to sports, burns, falls, and motor vehicle accidents. Surprisingly, we saw an increase in the rate of penetrating trauma in our pediatric population as well. So we'll start first looking at our overall trauma demographics. As I said, there was a statistically significant decrease in the rate seen in 2020, with there 71.6 cases per 100,000 pediatric population in North Carolina. There was a statistically significant difference in age, which comes from the patients in 2018 being slightly younger. There were no differences in gender. There was a statistically significant difference in injury severity score, which was higher in 2020. However, this was not a clinically significant difference. Looking at our decreased etiologies, falls remain the most prevalent etiology overall in all 3 years. However, that rate significantly decreased for 2020. Not surprisingly, there was a decrease in the rate of pediatric trauma cases due to motor vehicle accidents, which lines up with less road travel due to school closures and business closures during this time. Sports injuries also decreased, which goes in line with the cessation of recreational and school-related sports during the early parts of the pandemic. There were also decreases in pediatric trauma due to burns, and it was surprising that we saw a decrease in the rate of pediatric trauma associated with child abuse. When we were beginning this research, we anticipated seeing a higher rate of pediatric trauma associated with child abuse due to significant increases in stressors in the community. However, the opposite was seen. Looking a little bit further into this, as you can see, there was a decrease in the total number of traumas, the rate in 2020 for pediatric patients. There was no significant difference in age. There was a significant difference in gender, which is due to there being a higher rate of males in 2018. There was a higher mortality rate in 2020. However, this did not reach statistical significance. We also queried the welfare database looking at child abuse and neglect reports and saw a statistically significant decrease in 2020. Looking into the penetrating trauma, we saw an increased rate overall in 2020. We then broke this down into stab-related trauma and firearm-related trauma. While both increased, the increase in stab-related trauma did not reach statistical significance, while the firearm-related trauma did, with 5.9 cases per 100,000 children seen in 2020. On further evaluation, there was a slightly higher mortality rate. However, this did not reach statistical significance. And there was a higher injury severity score rate, which did reach statistical significance. The median was similar throughout all 3 years. However, as you can see from the interquartile range, there were higher scores in 2020. So in conclusion, we saw an overall decrease in the total number of pediatric trauma cases during our time period in 2020. However, there was an increase in firearm-related injuries. There has been research published on the increased rates of firearm sales during the pandemic, and there being more first-time firearm owners as well. There's concern for education on firearm safety and storage, which may be allowing children easier access to firearms and playing a role in this finding. Additionally, we saw decreases in child abuse trauma in reports, and we need to be cautioned that this may be due to decreased identification rather than a true decreased rate, as teachers are an important reporter who are not having contact at this time. So our recommendations coming from our research are to consider discussing firearm presence in the homes and discussing safety and storage during our primary care visits with pediatricians. And additionally, we need to be aware that there may be decreased rates of child abuse detection during times of school closures. And while schools are now reopened from the pandemic, there are still regular closures with holidays and summers, and people who come in contact with children during these times need to have an increased awareness. We'd like to thank the North Carolina Offices of Emergency Medicine Services and the North Carolina Trauma Registry Hospitals for allowing us their data. I'd be happy to take any questions.